questions before I started on what I talked about before? Okay, hopefully everyone is back. So we are going to begin with program components of continuum of care projects. Hold on, let me give you berries. So what are continuum of care projects? So there are several different types of continuum of care projects. So under the interim rule, funds can be used to support eligible activities under 5 components, or as I like to call them, buckets of funding. And these include permanent housing, transitional housing, joint transitional housing or rapid rehousing, which we call THRRH, supportive services only, and HMIS. Next, I'm going to discuss each of the program components in detail. So what is permanent housing? Permanent housing is a community-based housing without a designated length of stay. To be considered permanent housing, the program participant must be a tenant on a lease or sublease for a term of at least 1 year, which is renewable for terms that are on a minimum of at least month to month thereafter, and it's terminable only for cause. The CoC program offers funding for 3 types of permanent housing. There's permanent supportive housing, rapid rehousing, and the joint transitional rapid rehousing component. First, we're going to talk about permanent supportive housing. Permanent supportive housing, which we refer to, lovely acronyms, is PSH. It provides long-term assistance to individuals, youth, and families with a disability. Long-term assistance means that housing assistance can last for over 24 months and does not have a designated end date. And that assistance is provided until the program participant chooses to exit the program or is terminated from the project. Supportive services are designed to meet the needs of program participants and must be provided as needed. The overall objective of a permanent supportive housing program is to provide housing and services to the most vulnerable people experiencing homelessness who have a disabling condition. It helps to integrate participants into the community and promote housing stability. It assists participants to secure or increase their skills, income, and employment. It helps to provide links to appropriate supportive services and mainstream services. It helps participants reach self-sufficiency and provide long-term housing stabilization supports. Next, I'm going to talk about permanent housing, rapid rehousing options. Rapid rehousing provides short-term, which is 1 to 3 months, or medium-term, 4 to 24 months, rental assistance and supportive services to program participants in housing that is intended to be permanent, meaning that the program participant stays in the unit even after CoC program rental assistance ends. With rapid rehousing, you can provide rental assistance for up to 24 months, but after that 24 months ends, these programs are able to provide supportive services to assist that household in maintaining their unit for another 6 months. So they can provide case management, life skills, assistance with transportation for another 6 months after rental assistance ends in order to help them maintain that unit. I'm going to talk about the overall objectives of the Rapid Rehousing Program. The Rapid Rehousing Program provides housing and services to the most vulnerable people experiencing housing. Sorry, hold on 1 second. I lost my person who's admitting people. Rapid rehousing, let's go back to that. It helps provide housing to those most vulnerable. It integrates participant into community and promotes housing stability. Again, the same with PSH. It helps participants connect to income and employment resources and mainstream resources. It provides supportive services in order to maintain that housing option. There is also a new component that was introduced in the I think it was 2019, but I might be wrong. It's either 2019 or 2018 NOFA. It is the Joint Transitional Housing and Rapid Re-Housing component, which we call THRRH. I'm going to talk about this component, but currently the balance of state does not have any of these projects. What this project is and what HUD did with this project component was they combined two existing program components. So they combined transitional housing and permanent housing, rapid rehousing into a single project in order to serve individuals, youth, and families experiencing homelessness. Anyone in these projects was able to move, even though we don't have one, between transitional housing and rapid rehousing as needed in order to support them maintaining and sustaining permanent housing. Program participants are able to receive up to 24 months of assistance through this project component. The next project component is transitional housing. Transitional housing facilitates the movement of individuals, youth, and families to permanent housing within 24 months. This program component is very limited. They must have a lease for at least 1 month that ends in 24 months. And the lease cannot extend beyond 24 months. Currently, the Balance of State Continuum of Care does not have any transitional housing projects because HUD is focused on permanent housing as a solution to end homelessness. Currently, HUD does not consider transitional housing to be permanent housing. Therefore, anyone who is in a transitional housing project, because they're in that project, they would not be eligible for permanent housing under the Continuum of Care rule. The next component is supportive services only. This Continuum of Care program supportive services only component allows recipients and subrecipient agencies to provide services to individuals, youth, and families at risk of or experiencing homelessness. This component does not contain funding for housing, but only for supportive services. Please note that the law and the CoC program regulations state that operating costs may not be used to support supportive services only facilities. However, if an agency is providing supportive services for day-to-day operations, they're eligible under the supportive services budget line item with some restrictions. Supportive services only can be used to provide case management, life skills, mental health, substance abuse, child care assistance, transportation. It also includes street outreach. So we have 2 of these grants currently within the Balance of State. As I talked about earlier, we have the One Coordinated Entry Grant, which is subcontracted to 4 different agencies to provide street outreach to those at risk and experiencing homelessness, to connect them with our coordinated entry system so that we can help assist them in obtaining permanent housing. We also have the coordinated entry domestic violence grant as well, which is specific to those at risk or who are fleeing domestic violence. The next component is the Homeless Management Information System, as we call HMIS. This component under the CoC interim rule is only for HMIS leads. And it allows the HMIS lead, which in New Hampshire is the Bureau of Housing Supports, to support costs to manage and operate all 3 CoCs HMIS within New Hampshire. So what the Bureau of Housing Support is able to manage, operate, upgrade, or customize the 3 CoCs HMIS because we have these 3 grants. Next, I'm going to talk about NOFA, which is Notice of Funding Available, and I'm hopefully going to make somebody giggle. HUD is changing the name of the Notice of Funding Available to Notice of Funding Opportunity. So it will be from here on out, starting with FY 2020, called the NOFO. But I will continue to call it the NOFA. CoC program funding is authorized under subtitle F of the Homelessness Emergency Assistance Rapid Transition to Housing Act, which is called HARP. BHS, as the collaborative applicant for the Balance of State Continuum of Care, applies for the CoC funding through a community-wide Balance of State application as the collaborative applicant. The CoC program application takes place usually annually under a framework established by HUD and is carried out by the CoC with the Bureau of Housing Supports as the collaborative applicant. The collaborative applicant application for Continuum of Care funding includes several parts for the entire Balance of State geography. It includes, when we submit this application, it includes a CoC application, which contains all of our narratives for the questions that are posed in the actual Notice of Funding Available. And also the second part is all of the renewal and new project applications have to be submitted to HUD. The third part is the priority listing, which lists all of the renewal and project applications in order of ranking according to HUD standards, which I will talk about briefly. So typically, previously, about in FY 2019, when the NOFA was issued, HUD was talking about trying to standardize when the NOFA would be issued. Due to the pandemic, the FY 2020 NOFA was a non-competitive NOFA year, which means that all renewal projects were automatically renewed, and there was no process for new project applications last year. Typically, what happens is HUD will issue the Notice of Funding Available. It is a very lengthy document. I want to say it's about 100 pages, and HUD issues additional guidance based off of that document for each of the three parts of the application. What needs to be responded to in regards to the application, how to apply for renewal and new project applications, and how to complete the priority listing. So the NOFA actual issuance, the document that's about 100 pages, is just the first of many documents that the Bureau of Housing Support goes through before working on the actual NOFA submission. Upon the release of the actual HUD NOFA, the Balance of State notifies all of the membership and will typically hold a specific Balance of State NOFA meeting, which goes over any of the changes to the NOFA, any questions that you may have, what the new project scoring tool and renewal scoring tool may look like based on Balance of State membership voting. And typically what happens is, and I think most of you have already seen this, is as the CoC administrator, I will ask each of the subrecipient agencies prior to the release of NOFA if they plan on intending on renewing their project application. And we ask that all renewal notifications are sent no later than 1 week after the actual release of the NOFA. HUD will provide public notice and notice to all CoC program applications upon review and approval once the actual full application is submitted. And I'm going to talk about the rest of the project application in just 1 second. I just want to see if there's any questions. Here's my chat. Matt had a question. Matt, do you want to unmute? Okay. Matt, if you have a question, you're welcome to unmute yourself and interrupt me. Or put it in the chat. I will see if I can look at it. Thanks. All right, so next we are going to talk about NOFA elements. So the NOFA elements, as I talked about, there are 3 pieces to the actual overall submission of the Continuum of Care's application to HUD. There's the actual Continuum of Care application, which is a narrative and data sections regarding the entire balance of states planning, execution, and achievements to end and prevent homelessness. The second part is project applications. So all project applications, whether or not they're new and have been approved by the ranking committee, or the renewal applications, must be submitted to HUD. This application is a binding document and is part of the grant agreement. The final part of the project application is the priority listing. This listing is a list of all the applications that the balance of state is submitting as the collaborative applicant to HUD. So it lists every single renewal and new project application that we are asking for funding for. There are 2 different tiers to this priority listing, and the priority listing is based off of the renewal scoring tool and the new scoring tool on how you are scored. Each of those tools are voted on annually for any competitive NOFA by the balance of state membership, and they are issued prior to any finalization of that priority listing. So when we are looking at actual project application elements, so for both renewal and new project applications for all the subrecipient agencies, we are looking at the applicant's experience. What type of project are you proposing? What type of participants? Who are your priority populations? Are you looking at serving chronically homeless? Are you looking at serving those experiencing mental illness, families, youth, any of those things? We also specifically look at your budget. We are looking at HUD funding and match funding and documentation, along with your service partnerships with those people within your area that you are working with to provide supports to people in COC projects. For the balance of state continuum of care, we have a project application process that is usually set every single year. Once the NOFA is released, the Bureau of Housing Supports, as the collaborative applicant, will release a calendar with timelines for the entire process. This is usually presented at the balance of state meeting and may be modified, but it presents all of your internal timelines that need to be hit, both for the Bureau of Housing Supports as the collaborative applicant and for subrecipient agencies and for any new projects who are submitting. We share that timeline in the process of submission of applications with the entire membership, and we also put it on our website and send out information to the broader community about it. So once all of that is done, if you are a new project looking to submit information, it is submitted to the Bureau of Housing Supports. We review it and we submit it to, hold on one second, I'm sorry. Someone's trying to get into the meeting. Okay. So once we have all the information for the renewal and the new project information, we review all of the projects based on the renewal tool and the new project scoring tool, depending on what type of project you are. And if a new project is approved to be included for our funding request, we enter that information in and submit it to HUD. And then we wait for HUD to tell us what happens next. Some of the common issues that we see in new project applications is that timeliness standards are not met for submission of project details. There's inconsistencies in your actual project application, such as there's narrative descriptions that do not match data charts, or data charts don't even match data charts. So we're really looking for people when they're submitting new project applications to ensure they're answering the questions and that all of the information lines up within the actual project application. We need to make sure there's not generic narratives that are not responding to the actual questions that are proposed in the new project application. For example, when you're submitting a budget in a new project application, we need you to enter the funding that is actually spent and what you're asking for. So for supportive services, if you're requesting a full-time case manager, we are looking for the example of one full-time case manager to their salary, plus their benefits, plus fringe, or anything else that's included to be submitted for that category. You cannot just put that you're looking for one case manager at $40,000. There needs to be a breakdown of the costs incurred for that case manager. So once the Balance of State Continuum of Care and the Bureau of Housing Supports receives final approval and we submit everything to HUD for the NOPA, HUD will issue conditional award amounts and will send a subsequent award letter to the recipient of the grant, which is the Bureau of Housing Supports. Any funds for projects that receive rental assistance or leasing assistance, those funds, once they're awarded by HUD, are adjusted by what the current fair market rent is. So what we have seen in the past couple of years is that most fair market rents are going up. So most of our projects that have rental assistance or leasing and actually operating costs in the last couple of years have seen their projects award amount go up because fair market rents have been increasing. We have also seen, though, we have seen one or two projects in the last couple of years where fair market rent has gone down in their geographical area, and they have lost a little bit of funding for rental assistance. When that happens, HUD still expects your agency to be able to support the number of households that you submitted in your project application. When HUD asks us for the grant agreements, the Bureau of Housing Support as a recipient must ensure that all of the conditions are met before the execution of a grant agreement. So the Bureau of Housing Supports must make sure that site control is established, which means there's evidence that a project sites are secure and that subrecipients can operate in given locations. An acceptable evidence of site control is a deed or a lease. In addition to standard conditions, HUD may impose additional conditions such as requests for supporting documents, revisions to the project budget, or modifications to a proposed activity to ensure compliance with HUD regulations. HUD will withdraw an award if the application does not satisfy all conditions. So typically what HUD will do specifically more with new project applications is they will send a technical submission, or what I call an issues and conditions application, back to the Bureau of Housing Supports. And we work with any new or renewal projects, if that happens, to identify what are the issues and conditions that HUD is looking at. Some of the examples of conditions may include requests for supporting documentations on a project, again, the revisions of project budgets, modifications to a proposed activity, or making sure an activity is in compliance with regulations. Sometimes what may occur with new projects specifically is that when fair market rent changes, it will alter their budget, or they're looking for further information on how they're going to meet specific requirements of a HUD grant, such as connecting people with mainstream resources or employment services, things along those lines. So the Bureau of Housing Supports will work with subrecipient agencies to make sure that these issues and conditions of a project application are met. and that it is approved by HUD. And this submission has to be completed before a grant agreement is executed with HUD. HUD also expects before a grant agreement is executed that an environmental review occurs. An environmental review is a review of the impact of any CoC project on the local environment and the impact of the environment on the project. New projects that are awarded by HUD cannot proceed forward until the environmental review is complete. Every single renewal project has an environmental review completed every 5 years or sooner if environmental conditions change. With most tenant-based or leasing-based projects, BHS will request the addresses of the units to submit to HUD with the environmental review to ensure there is no local impact. Next, I'm going to go over what is match. Just want to check.
Christy, before you do that, Matt Close had a question. I don't know if he was able to ask it or not.
Matt, I am willing to listen before I move on to the wonderful topic of match.
Yeah, this question was like a long time ago, which is fine. It's totally okay because I know that you're looking at your PowerPoint and not seeing it. I was just wondering, it was when you were talking about PSH and you said that HUD does not consider transitional housing qualified for PSH. But if somebody is in transitional living, does that disqualify them from being on the list for PSH?
So that's a loaded question. So for CoC permanent housing funded projects, if someone is in transitional housing or transitional living, the definition needs to be explored of what that actually means and how that project defines it.
Okay.
So it's a little bit of an offline question, but it does not prohibit them from being entered into the coordinated entry system and being eligible for other opportunities through coordinated entry.
Okay. All right, then that's a question for you and I to talk about later because you know what's going on over at Birch House, so we can talk about that offline later on.
Yes, and I talked to them last week too. So
yeah, I know.
Okay.
All right. Sorry.
All right. Anyone else have any questions before I get into match? Which is everyone's favorite subject lately. And I want to say thank you to all of you for sending me all of your match letters and all of your MOUs. Thank you. So I'm going to go into match. Match is one of the things that is required for all continuum of care programs through the NOFA. Match is 25% at a minimum of the total award amount, with a caveat that this includes any project that is awarded leasing funds. Match funds are not connected to any one budget line item. So match is for your overall project award amount. It's not connected specifically to rental assistance or supportive services or administration costs. It is connected to the overall award. Match can be either in kind, cash, in-kind services, or in-kind donated goods. Eligible in-kind match contributions are things such as value of real property, equipment, goods, services. But more simply, an in-kind match contribution is a donation or gift of time, internal financial resources, professional expertise, use of facilities, project sponsorship, equipment, or other comparable donations without charge that are equal to the direct financial contributions from one or more private or public organization. All in-kind match contributions must be documented by a memorandum of understanding between the recipient and subrecipient and the third party that provides the goods and or services, equipment, or real property. The Bureau of Housing Supports is responsible to ensure that any funds used to satisfy the matching requirements are eligible under the interim rule to ensure that funds from other sources are not statutorily prohibited to be used as match. So what is not match? Match is not a program participant's savings. Rent is not match. Savings belong to a client is not match. Program fees are not eligible under the CoC program rule. It cannot be charged to a program participant and cannot be used as match. Any cash or in-kind contributions used for another grant or whose funding stream statutorily prohibits them from being used as match are also not allowed to be used as match. Some example
There's
of
a
match.
question in the chat. The PowerPoint notes, will they be available at the end of the meeting?
Yes, so this entire webinar is being recorded and I will be sending out the entire PowerPoint to everyone. So I'm going to go over some match examples. So the first column shows a continuum of care project budget that does not have leasing funds. So you can see we have 25,000 in supportive services, 20,000 in rental assistance, 4,500 in project administrative fees, and your grant total is 49,500. So the required match is 25% of that 49,500, which equals 12,375. If a project, as you can see on the right, have leasing funds, same budget, you would only need to match supportive services, which is the 25,000, the project administration, which is 4,500 for the match. So it's only 25% of 29,500 because it does not include the amount for leasing. And there's very few and limited leasing projects within the balance of state. I think only one subrecipient agency has leasing projects. So there's three types of match, as I talked about. There is cash match, which is when the Bureau of Housing Supports or the subrecipient agency is using cash resources to pay for an eligible cost. This is actual cash that is committed to the project. And it has to be substantiated in a commitment letter and tracked through financial statements. This has to be money not specifically dedicated to an agency. So if someone gives an agency $20,000 and only 5,000 of it goes to the CoC agency, it needs to be very specific on how the cash match is worded. It cannot be an allocation of a $20,000 donation. Eligible activities for cash match include staff time to carry out an eligible activity with funds from an agency that are not CoC grant funded programs. So for cash match, it must be documented on a letter, which BHS has provided templates to all of the subrecipient agencies for. This letter must include the amount of cash to be provided for the project, the specific date the cash will be made available, and what the actual grant and fiscal year that this will be contributed to, and what allowable activities this funding will be utilized for. Any documentation for this match needs to include the agreement, how the tracking is done, and the source documentation for cash match that is spent on eligible activities under the CoC program rule. So any of the match needs to be eligible under the program rule for cash match. It can be supportive services that staff are spending time on, such as case management. It can be administrative services, things along those lines. Next, we're going to talk about in-kind match. There are two different types of in-kind match. In-kind match is when another provider agrees to provide funds for an eligible cost under the CoC interim rule, which I talked about, could include staff time to carry about an eligible activity with funds from their agency that are not directly coming from the CoC program grant funds. So there are both in-kind services, which are those services that we just talked about that are not funded through the CoC program. And if you are using that type of match, you have to submit an in-kind services match letter along with a memorandum of understanding for those services. That MOU has to have certain bullet points within it, and the Bureau of Housing Supports has also provided a template for that as well. It has to describe the services specific to the project, talk about the qualifications of the persons providing the services, the scope of those services, how many people are going to be serviced by those services, what grant year and grant term those services will be provided, including details of the actual quality and value of the services provided to those program participants. So for an example, if you are working with a local mental health agency to have them provide in-kind services for mental health, you would need to document their qualifications as mental health providers, how many approximate participants are going to receive those services, an hourly rate and how that hourly rate was determined based on a fee schedule, and what documentation is there going to be for that service provider to provide those services between the subrecipient agency and the service provider agency. And we talked about this side. So how to determine cash versus in-kind services, which I know has been a hot topic. Cash match for services is money your agency actually has committed, either cash on hand or contract, to the budget project and spends on project eligible activities, and it's tracked through your financial systems. So for example, you have a housing project that has 3 staff and the United Way is paying specifically to this project cash to support one of those positions. In regards to in-kind services can be donated by your own agency or another agency. They're not directly tied to the project budget. These can be donated goods or services based on eligible activities. So, for example, a housing project may receive case management services from another team within the agency or a partner agency, such as like Head Start or a mental health center, as I talked about earlier. I'm drawing a blank on another one. So what Bureau of Housing Supports is looking for is for subrecipient agencies, especially since the FY 2021 NOFA is coming soon, is looking at verbally securing match commitments prior to the FY 2021 NOFA release to make sure we have timely submissions when the NOFA is released. We want you to review community and in-house resources, typically accessed by your project participants, to see if they can be utilized as a source of match. And then approach those agencies to explain match commitments and the value to the overall community through those commitments. And then look at how to determine the value of goods or services your project participants may use during the year. And then finally, we are going to talk about performance measures. So I'm going to go over a couple of terms that are key to this. There is the PIT, which is the point in time count, the HIC, which is the housing inventory chart, and HMIS, which again is our homeless management information system. HUD has released system performance measures, which are submitted annually by each of the continuums of care. This information is shared with the entire balance of state membership, but system performance measures include looking at decreasing the length of time a person remains homeless. So looking at how the overall continuum of care is reducing the length of time people remain homelessness. They're looking at the average time and the medium length of time that people remain homelessness. The system performance measure number 2 is reducing recidivism. So we are specifically looking at how many people exit homelessness to permanent housing destinations, but then who return to homelessness. So trying to make sure that once we do have people in permanent housing, they're staying and able to maintain their permanent housing, and they're not exiting back to homelessness. System performance measure level number 3 is a reduction in the number of persons remaining homeless. So really looking at the point in time numbers that are completed in January and looking as a CoC to see that we are reducing every single year how many people are actually experiencing homelessness in the state of New Hampshire and within the balance of state. System performance measure number 4 is very specific to continuum of care projects. It specifically looks at employment and income growth for anyone experiencing homelessness who is in a CoC funded project, which includes changes in earned income for anyone in the project during the reporting period, any changes in non-employment income, any changes in total income for people who remain in the project. And it also separately looks at anyone's changes in income, non-cash income, and employment for those people who exited the project during the reporting period. It also looks at reducing the number of people who become homeless for the first time. So really looking at how is the continuum of care's prevention and diversion working? Is it working? Are we able to prevent people from becoming homeless in the first place? Also at looking at finding successful placement from street outreach and finding successful placement and retention in permanent housing. Every single year, HUD asks the continuum of care to submit the system of performance measures. This also impacts the data that is submitted with the NOFA application every single year. It ties into how we are scored based on the data that is submitted to HUD each year and whether or not we are making improvements in these system performance measures, which in turn determines part of our scoring on the NOFA application and whether or not we score well or do not score well. So what can subrecipient agencies do right now? They can review data quality for their projects. You can look at increasing your HMIS bed coverage, whether through CoC or non-CoC funded projects. You can review HUD published guidebooks on performance measures. Also conduct an initial review of HMIS capacity to ensure that you're meeting reporting requirements. Are you meeting the standard of entering data within 5 days per HMIS data standards within New Hampshire? And also really looking at defining a method to use and how you're reviewing data moving forward. So that is one way that the CoC is evaluated based on performance monitoring by HUD. The balance of state continuum of care also conducts yearly performance monitoring of continuum of care projects specifically. So HUD monitors the system, balance of state continuum of care monitors the projects, and this is both on performance. So each year we review continuum of care projects annual performance reports. These reports are looked at to determine how a project is performing and determine if a project should be reallocated according to the balance of state reallocation policy. Each year we develop annual performance standards in consultation with HUD the Bureau of Housing supports required measures and approval by the balance of state continuum of care membership. In the past couple of years, the projects have been reviewed on HUD's expected performance measures. So we review them based on the system performance measures that I just talked about that are specific to continuum of care projects. So in April of 2020, projects were reviewed on, not 2020, I'm sorry, 2021. They were reviewed on increased program participants' earned income, unearned income, participants' ability to obtain non-cash mainstream benefits, the percentage of the grant that was expended for the last full operating year, the percentage of HMIS clients or comparable database clients that had null or missing values for each of the required HUD universal data elements. Each project was reviewed on their timeliness of data entry into HMIS or comparable database, and also whether or not there was an annual performance report submitted to HUD before the 90-day deadline. So each year we look at performance monitoring, what HUD's expectations are, and tie that into the system performance measures to ensure that continuum of care projects are operating at where they should be high performing projects. And if they're not, we issue a corrective action plan and provide subrecipient agencies with a year to correct those issues. So I know this has been a very long presentation, and I thank you all for bearing with me. I'm going to open the floor to questions in 1 second. I will say that HUD FY 2021 NOFA may be coming out in the next couple of weeks, just to let you all know. We've heard from Norm at HUD. It should be issued within, I would say, the next month, but that could always change. So we will be reaching out to you directly in regards to that. Secondly, the HUD CoC 102 training that I'm going to be doing in September will be a much more interactive training and will include exercises and activities that will include how to document chronic homelessness, how to complete rental calculations, income verifications, utility allowances. So really the hands-on participant file eligibility documentation. So we will be going through that as well. So I will open the floor to any questions.
When is that next training that you were just speaking about?
It has not been scheduled yet. It will probably, because I'm waiting for the NOFA to be released, I haven't scheduled it yet. I'm looking probably at the end of September, depending on NOFA. Sooner if possible. I will let you all know as soon as possible.
Christy, did you say that rental income was not matched
Craig,
for permanent housing?
So if you're a leasing project, program income is eligible as match. Craig, you can email me offline about that one. Okay. Well, if there's no other questions, thank you all for doing this training with us. We will post it as soon as possible. The Bureau of Housing Supports does have the ability through the Department of Health and Human Services to post recorded training, so we will be able to do that. I will send out the recording as soon as it is finalized, along with the slides for all of you. And I look forward to seeing you in September, and happy NOFA season soon. Thank you.
Christy, are you available anytime tomorrow for a phone call?